Hey, good morning, y'all. I'm back and I want to talk about the different types of therapy. I'm not here to tell you which therapy to uh look into. I'm just giving you some education around different therapeutic approaches. So there's the CBT therapy, which is cognitive behavioral therapy. Um, It's more like an evidence-based approach, and it focuses on identifying and changing negative thought patterns and behaviors. Then there's DBT, which is kind of a form of the cognitive behavioral therapy. Um, it uses a combination of CBT concepts from kind of like a mindfulness and acceptance um, point of view. Um, This therapy was actually initially created for treating borderline personality disorders. All right. And then another therapy is EMDR, eye movement desensitization reprocessing. And that therapy sometimes is used to alleviate stress related to like traumatic memories or like post-traumatic stress. Um, so what happens is it kind of makes a person recall the events. Um, and in that therapy, it requires them to use side eye movements. So those are three. Again, I'm not telling you like which route to do or anything like that. I'm not a clinician. I'm just, giving you education, just telling you the types that are out there. Um, and then, once you decide, okay, well, I know I need therapy. All right. So I'm aware now of the different types of therapy that are available. So then you want to start looking into finding the right therapist. You have to choose a therapist that suits your needs. So my therapist may not be for you, and your therapist may not be for me, right? So one, you want to make sure that you identify your needs and goals. Um, you want to make sure that you want to clarify your goals for therapy. For example, if you have issues with anxiety or dealing with trauma or improving relationships, you want to set those kind of goals so it can kind of help you decide what type of therapy you may want to look into based on your individual needs. And then, of course, you can research potential therapists in the areas. Um, what is it? Psychology Today, I believe, is a platform, and it'll give you information about different therapists. It'll tell you about their credentials, their experience, location, what they specialize in, their therapeutic approach, etc. And then you want to consider what I consider practical factors. You know, what is the location? Do they offer virtual appointments? For those who may have transportation issues. What is the cost? Do you have to pay out of pocket? Will they accept your insurance? Will they accept like a sliding scale fee for a reduced cost for your sessions and services? And then the availability, you want to kind of make sure that your availability um, and your therapist's availability matches. And then you want to evaluate compatibility. Um, Sometimes therapists will set like a 30-minute consult, a free consult. And well, I'll say from 10 to 30 minutes, just depends on who it is, just to kind of get a feel to see if you are compatible, if they are for you, have you developed some type of connection or a little bit of trust within that initial consult. You might want to check out their communication style to see if that's going to meet your needs. And then, of course, you want to ask questions too. You might want to ask your therapist their experience as it relates to whatever your specific issue is and their training, their therapeutic trainings, what kind of approaches do they use? You might want to talk to them about what a treatment plan would look like. You might want to talk to them about the ethics guidelines as far as, keeping your information confidential. And then, of course, you can also seek recommendations from family and friends, or maybe even your medical provider can give you some suggested referrals, and then you make your decision from there. And then again, like I was saying with psychology today, oftentimes it gives like reviews and testimonials and things like that from other clients. Yeah, so I hope these tips have been helpful. Again, today's message was just to give you education around the different types of therapy and how you can choose the right approach of therapy based on your needs. This message is not, again, not telling you to choose either one. I'm just giving education around it. So that way, when you're selecting your therapist, consider your goals or whatever the case may be. I hope these factors will be effective to you. So, yeah, that's it. Hope to see you all again next week. And so if you take some of these steps to help you find a therapist that's well suited to support you on your journey to better mental health, you'll be able to start seeing the enhancement in the overall quality of your life. It won't be overnight. It's going to take some steps. It's going to take a little bit of work, but therapy is it is therapeutic. It is helpful. It is effective, and it can help to shape and mold your life. All right, y'all. Take care.